Initiating launch sequence.
A coworker came to me and asked me if I think that the Antichrist that everyone is expecting, waiting for, could be AI. Could there be an argument made that the Antichrist is AI? The more I thought about it and the deeper I searched, he may be on to something. According to a site called AI 2027, we should be fully enmeshed in the AI takeover by March 2027. Do you remember that movie back in the 80s with Matthew Broderick called War Games? In that movie, we learned that computers are simply doing an assigned task. There's no trappings, no human trappings of conscience or need to consider feelings. There is no attachments, no worry about repercussions or harm. They're just doing what they were programmed to do. They're doing a job. A few years back, there was a system called Project Maven. According to Wikipedia, Project Maven is a Pentagon project involving using machine learning and data fusion to process data from many sources, identify potential targets, display information through a user interface, and transmit human decisions to weapon systems, among other functions. The technology was so scary that Google employees went on strike to protest it. Palantir had no problem stepping up to the plate. Palantir is in everything. In participation with the White House, AI has constructed the physical and digital infrastructure required for a pre-crime, technocratic police state. Palantir works with health insurance agencies to handle insurance claims. It wasn't discussed much in the headlines, but Trump nominated a seasoned official of the biosecurity apparatus named Susan Monterez to be the director of the Centers of Disease Control and Prevention, the CDC. Monterez has a background that is perfectly in line with a technocratic approach to healthcare. Her appointment to the CDC indicates a further melding of America's public health institutions with the national security state. Our health care is being hijacked by the surveillance state at the intersection of big tech, big pharma, and the military-industrial complex, all in the name of public health and safety. Trump also announced an initiative to enable the vast sharing of individuals' health data across a myriad of health systems and apps in partnership with Pentagon contracting big tech companies. AI is in your Wendy's frosty sails. It detects corrosion on Navy vessels. It provides cloud services through Amazon for the Israeli government. AI is the dark shadow hanging over your healthcare decisions. The Pentagon and Silicon Valley are in the midst of cultivating an even closer relationship as the Department of Defense, DoD, and big tech companies seek to jointly transform the American healthcare system into one that is artificial intelligence AI driven. The alleged advances of such a system, espoused by the Army itself, big tech, and pharma executives, as well as intelligence officers, would be unleashed by the rapidly developing power of so-called predictive medicine, or a branch of medicine that aims to identify patients at risk of developing a disease, thereby enabling either prevention or early treatment of the disease. This will apparently be achieved via mass interagency data sharing between the DoD, the Department of Health and Human Services, and the private sector. In other words, the military and intelligence communities, as well as public and private sector elements of the U.S. healthcare system, are working closely with big tech to predict diseases and treat them before they occur, and even before symptoms are felt, for the purported purpose of improving civilian and military health care. This will apparently be achieved via mass interagency data sharing between the DoD, the Department of Health and Human Services, and the private sector. In other words, the military and intelligence communities, as well as the public and private sector elements of the U.S. healthcare system, are working closely with big tech to predict diseases and treat them before they occur, and even before symptoms are felt, for the purported purpose of improving civilian and military health care. This cross-sector team plans to deliver the transformation of the healthcare system by first utilizing and sharing the DoD's healthcare data set, which is the most comprehensive in the world. It seems, however, based on the programs that already utilize the predictive approach and the necessity of machine learning in the development of AI technology, that this partnership would also massively expand the breadth of this healthcare data set through an array of technologies, methods, and sources. Yet, if the actors and institutions involved in lobbying for and implementing this system indicate anything, it appears that another, if not primary, purpose of this push towards a predictive AI healthcare infrastructure is the resurrection of a Defense Advanced Research Project Agency, DARPA, managed and Central Intelligence Agency supported program that Congress officially shelved decades ago. That program, Total Information Awareness, TIA, was a post-9/11 pre-crime operation which sought to use mass surveillance to stop terrorists before they committed any crimes through collaborative data mining efforts between the public and private sector. While the pre-crime aspect of TIA is the best known component of the program, it also included a component that sought to use public and private health and financial data to predict bioterror events and pandemics before they emerge. This was TIA's biosurveillance program, which aimed to develop necessary information technologies and a resulting prototype capable of detecting the covert release of a biological pathogen automatically and significantly earlier than traditional approaches. Its architects argued it could achieve this by monitoring non-traditional data sources including pre-diagnostic medical data and behavioral indicators. While ostensibly created to thwart bioterror events, the program also sought to create algorithms for identifying normal disease outbreaks, essentially seeking to automate the early detection of either biological attacks or natural pathogen outbreaks, ranging from pandemics to presumably other less severe disease events. As previously reported by Unlimited Hangout, after TIA was terminated by Congress, it largely survived by privatizing its projects into the company known as Palantir, founded by PayPal co-founder Peter Thiel and some of his associates from his time in Stanford University. Notably, the initial software used to create Palantir's first product was PayPal's anti-fraud algorithm. While Palantir, for most of its history, has not overtly sought to resurrect the TIA biosurveillance program, that has now changed in the wake of the COVID-19 crisis. AI is also controlling the medical revenue cycle management. That's RCM. R1, an industry leader in revenue cycle management, RCM, with over 20 years of experience, and Palantir Technologies, a leader in artificial intelligence systems, have partnered to launch R37, an advanced AI lab dedicated to revolutionizing healthcare financial performance. By combining R1's deep category expertise in payer-provider dynamics and proprietary technology capabilities with Palantir's cutting-edge AI tools, the lab will develop intelligent automation solutions to address the most pressing challenges in healthcare reimbursement at an impressive speed and scale. Administrative costs now account for more than 40% of hospital expenses, with over $160 billion spent annually on RCM. As providers face escalating economic pressures and complex payer relationships, AI native solutions have become a necessity. R37 will drive comprehensive automation in revenue cycle operations, re-engineering labor-intensive processes such as coding, billing, and denials management to significantly improve efficiency, accuracy, and cash flow for healthcare organizations. R1's extensive reach, serving 94 of the top 100 U.S. health systems, uniquely positions it to transform RCM. R1 has been supporting automated revenue cycle workflows at scale across the largest repository of proprietary RCM structured and unstructured data. The repository includes 180 million plus annual payer transactions, 550 million annual patient encounters, 20,000 proprietary payment algorithms, and 1.2 billion annual workflow actions. By integrating Palantir's AI tools and capabilities with R1's existing technology and domain expertise, R3 can unlock faster, more precise, scalable reimbursement outcomes. I will not read any more of that, and I apologize if you feel I read too much, but I wanted to make sure that you caught that they're into everything. Because of Doge, Palantir has streamlined all of our personal IRS data in one place. They have created a searchable database of all U.S. taxpayers' records. Did you know that AI was incorporated in the Who's Your Daddy campaign in Gaza? They were able to pinpoint when targets returned home to their families for mass effect. Effect means casualties, in case you needed that broken down for you. I'm hoping by now I've created a clear picture. If AI can do all of these things I've discussed so far, just how easy would it be to program targeting people that have dissenting opinions or voices? We've already seen this in the arrests on college campuses. We've seen it with the ICE roundups. Did you think that they're doing all of this by facial recognition? Some people think that they can just slip on a hoodie and keep their head down. Did you know they can now tell who a person is by the way they walk? Palantir is changing the face of politics. With the use of governance by algorithm, they are co-opting the language of revolution and trying to make people believe that it's okay for the decision making of this country to be in the hands of a few dozen people. So AI is not just one thing. It's in the hands of just a few people. And that can change depending who's in leadership at the time. We can see right now that a lot of things are being taken over in the name of health and safety, or in the name of trying to get people out of this country that don't belong here. But we are now a surveillance state, and every decision we make, whether it's buying socks, buying a Frosty, or going to the doctor, everything is being streamlined into one system. And that, being part of the collective, is, it could be argued, is the Antichrist, depending on who's controlling all of these measures. My suggestion for people is to be predictable. We as mothers, we know that children can be greatly unpredictable. Stop posting everything you do on social media. Again, stop being predictable. The Bible tells us, don't let your left hand know what your right hand is doing. I believe that those people that went to war and came back and hit the woods and never were seen in society, I think that they knew something and we should have taken notice. So the time for us to bug out or whatever, I think those are way past. But again, like I said, stop doing everything online. Start using cash and start being unpredictable, and stop believing everything you hear in the headlines. If you hear something that raises your blood pressure a little bit, research it. And also remember that while you're cheering for them to do something against those guys, the same technology can be turned around and used against you if need be. If they don't like the way you worship, if they don't like the way you do anything. I mean, people are getting arrested for water catchment systems. So just think about all of these things and be the resistance. That's all I've got for you today. Love y'all.